happy. Oh, little friend, take my hand. Okay. All right, so this is kind of like the other one I just did with the having a. I was just outside and it was windy, so it was good because it was good temperature, but it's pretty windy. It's just like the other one, sort of, with the centralized database with the job resume and stuff, but I would like to have a centralized database with the healthcare information and more to the point with my healthcare information and my personal information, because I don't know about anyone else out there, but it is annoying as all hell for when I have to go to a new doctor, and I've over the past 4.5, 5 months, I've had to go to 3 new doctors. And every time I have to, they hand me, oh, just fill this out. And it's, oh, just fill this out? Just fill this out? Oh, okay. Well, this is like 12 pages of crap. It's always the same thing. And me, because I'm not like, normal sheeple, I read this stuff because it's an entertaining Bible to read. The first few pages are just, the normal garbage that you have to fill out with, which is always a nice test, lots of handwriting and stuff, but it's still horrible that, I have to fill it out and we don't. Like, again, most like European countries, and probably by now, like the United Arab Emirates and stuff like that, we don't have like a card that just, you scan it and it's like, oh, thank you, just over there. Really? You just scan a card and off you go and sit until the doctor sees you? But anyways, you fill out all the information, go to the next page, information. Really, I even have to fill out my insurance card information that you asked for. The information on the card that you asked for and scanned, and you want me to put it on the piece of paper still. All of the information that is on the card that I gave you and you scanned, the numbers on the card, all right, fine, I'm game. That sounds totally pointless, but yeah. And yet they're talking about governmental waste. But whatever. So we go through this exercise all the time, and then I get to the greatest part of all. 7 pages of how they're lecturing and threatening me about how if I don't pay, if the insurance doesn't pay, they're going to sick the cops on me about, oh, we going to get you, motherfucker. You best believe that we going to get our money. And it's like, really? All right. Give it your best shot. All right? Because blood from a stone, right? Yeah. Um, and then they have you initial here, sign here, initial here, fingerprint here, put your dick print here, anus print here, initial, sign, print name, initial, squint here. I mean, it's just like, wow. I mean, bleh, really? I don't know. Like, it's just really, truly lost for words. I don't know. I mean, what else do you have to go through? I don't know. I can't think of anything else that you have to go through so much crap and so much bureaucracy in order to do something so simple. It's fantastic. It's all, it really is all so they can like just have every kind of legal check mark covered just to make sure they get money. Just to make sure that it's not to make sure they get money, it's to make sure that you don't have an easy legal out for them to not get money, I think is what it really is. Because they know, they pretty much know, you know, they're overcharging for everything. And not by a little. This goes off on a little bit of tangent everywhere, but I've seen my bills for stuff. When I look at bills that I get, it's like $1,284 for X, insurance, Medicare paid, $1,100. You owe $184, and I'm like, wait, does that mean that Medicare already gave you more than $1,000 and you're still coming after me for that? And I've had things even as petty as like, it was like $802.04 and Medicare paid $800 and they're coming after me for $2.04. And I'm just like, are you shitting me? You can't just be like $2.04 and a line that says, "Nah, man, you good. You're okay. We got that $2.04. We know how broke you are. Just don't even worry about the 204. We're good." It's just like, seriously? You're gonna come after me for less money than a McDouble? That's what you're worried about. Seriously? That that seems that seems I would say petty, but petty is too big of a word for what that is. So I don't know how to use a word for that. Microscopically petty. Like, yeah, that seems fucked is what that is. Fucked beyond fucked. Super fucked. Yeah. Super fucked. Yeah, that's what that sounds like. So, yeah. And it's just all this shit. There's so many things about the healthcare system that is just like, wow. Why is this? Wow. This is just You know that scene from Friday when they're just like, damn, that is the perfect GIF for the healthcare system. Just like imagine that scene played in your head whenever you think of the healthcare system. And it's like, yep, that's it. That right there. That is a perfect visual metaphor for our healthcare system. It's like that's it right there. Unless you're really rich, then you're like, what is he talking about? Our healthcare system is the best healthcare system in the world. It's like, yeah, exactly. You don't get it. You're a billionaire. Of course you don't. Of course you don't understand. So, like you get, it's like you you regularly fly in a jet made of gold, and somehow it still flies. Your jet is made out of heavier metal than metal. It's made out of uranium, and somehow it still works. I don't. It defies actual aerodynamic principles, and somehow works. But I don't know. You live under a different set of rules than the universe operates in. But yeah, whatever. I mean, I don't know. Anyways, that's it. That's what I was talking about. Anyways,